Why should, say, a parent of a child in a school today that's bringing in SEL programs, why should they be concerned other than just the difficulty in defining it?
Well, I think you basically laid out some of the risks. I mean, you are talking about allowing concepts like uh, gender, different ideas about gender to kind of creep into the schools. You start talking about these programs that will basically every nightmare that you've possibly heard over the last few months, you will get as a result of this social emotional learning. But there's an even bigger problem at play here. What you don't have in this setting is you don't have a proper educational environment for children. And let me explain what I mean by that. Social emotional learning, if you remember from the Castle website, they talk a lot about developing self-esteem on the part of children. But here's how children develop self-esteem. They develop self-esteem by developing competencies, by developing successes, by developing by learning, basically learning in the way that we all have learned, learning about language, learning about mathematics, learning about history, learning how to think critically, not necessarily critically like we think of with critical theory, but how to really look at something and weigh, what is the truth or lack thereof of it. If you start working on just imputing self-esteem to a child and not providing them with these academic opportunities to have success, then what you end up with is this very, very vacant sort of self-esteem that's not really built on anything. And it becomes just a shell of itself. Direct result of these SEL programs, this artificial self-esteem has led to just almost a collapse in the emotional well-being of our children. I think that this is, to a large extent, Alex, why I have seen such a tremendous increase with children down to the age of 8, 9 years old who are presenting to my office now with complaints, significant complaints of depression and anxiety. And these, I'm seeing this to levels that in 20 years of practice I have never seen before. And what's the common denominator? The common denominator is they've been denied educational opportunities. They've been fed this program that kind of teaches them about self-esteem that's not based on accomplishment. And so as a result, it's like a house of cards that just kind of crumbles on itself. And my feeling is that our children deserve better than that. And it's very simply this. If you accept the Hegelian dialectic, then what you really are saying is that there is no objective truth. There is no objective truth. It is simply this compromise between your viewpoint and my viewpoint. And out of that will come a new viewpoint. Now, this is a fine thing to teach children if your goal is to ultimately down the road turn them into little Marxists. I mean, I hate to be so blunt about it, but if that's what your goal is, then that's a good way to do it. But if what you're saying is that there is no objective truth, I mean, I've got legislators that voted to pass this bill, did so with very, very good intentions, and that this is something that's way outside their pay grade in terms of knowledge. But one of the things that this bill does is it grants to school counselors the authority to make behavioral health diagnoses. And then this is a very serious thing. If you're talking about having a school counselor who may have a master's degree, maybe. If you're talking about a school counselor who now is all of a sudden able to put diagnoses on children, significant diagnoses like major depressive disorder or some types of post-traumatic stress disorders or bipolar disorders or the more serious thought disorders, that becomes really quite critical. I mean, think about one of the implications of this. First of all, these diagnoses, once they are put on somebody's record, become almost impossible to get rid of. If you are not a person that has substantial resources, it is almost impossible to get rid of some of these diagnoses. And also, let's think of another implication. I realize this is a little bit off the topic, but let's think of another implication of that. Let's say that you place a diagnosis like major depressive disorder on a 10-year-old, let's say. And say 8 years from now, when that child is 18 or 21 or whenever, all of a sudden he decides that he would like to purchase a firearm in the state of Georgia. Do red flag laws come into play now? Because of a diagnosis that may have been given to him by